We check the amendment.
So this is Senate Appropriations, and we're trying to move some bills, and so we are taking up H622, which is an act relating to emergency medical services. We have the Chair of Health and Welfare, who happens to be on the committee, as well as Jen Carby from Ledge Council and Nolan Langwell from Joint Fiscal. I don't know if you want to go through what this does. Where there's money here, but it's not general fund.
The little, very little. But you put it in, I believe it's account for.
There's a little bit of Medicaid money in there.
Okay. Medicaid money. So, but I do want to just come up, Jen and Nolan, if you want to come up, both of you,
Sure.
sort of run through the bill and, oh, you're talking about the 42,000 general fund?
Yeah.
We're starting 31,000.
Yeah.
Okay. All right. So why don't you just run through the bill quickly and.
Okay, Jen Carby, I was in Legislative Council.
Noel Langwell, Joint Fiscal Office.
So this is H622 and actually related to emergency medical services, largely the as passed by House version. There are small amendments from Senate Health and Welfare and Senate Government Operations. But mainly what the bill does, it starts out by adding some purpose and findings to the existing statutory section on setting up the chapter on emergency medical services. That's the first section. Section 2 adds some language to the existing statute on the emergency medical services special fund, which the Commissioner of Health currently administers and is to be used for training, data collection and analysis, and other activities related to emergency medical services personnel and delivery of emergency medical services and ambulance services. The language directs the commissioner to prioritize using the funds to provide grants to programs offering basic emergency medical services training at low cost or no cost. Also has some language about trying to expand geographic equity in distribution of grants from the fund. Section 3 is the first place that has a fiscal impact. This is adding provision to the Medicaid statutes, saying to the extent permitted by federal law or waivers, the Agency of Human Services shall reimburse an EMS service provider for delivering emergency medical services to a Medicaid beneficiary who is not transported to a different location during the period of the emergencies. This is treatment without transport, and it specifies the reimbursement would be in an amount equal to the Medicare basic life support rate. This reimbursement for treatment without transport in Medicaid has begun fairly recently. DEVA has started to pay for treatment without transport, but it's at a reimbursement rate lower than the Medicare basic life support rate. So this sets that as the floor, actually as the amount to be reimbursed at, as the Medicare basic life support rate. I don't know if you want to say
That's
what
the
that.
31,206 general fund.
Yeah, 74,000, yeah, local.
What, 31,000 general fund?
31,000, yeah, general fund, and then 74,000 GC,
Right, so the state federal match.
just to bring it back to.
And you say that was one of the increases we did include.
Yes.
With our emergency.
You have included that in the.
Okay.
And then in addition, in that section, annually as part of its budget presentation, the language directs the Agency of Human Services to report on the amount of additional funds that would be necessary to reimburse EMS providers at a level equal to, and the language that came from the House was the Medicare basic life support rate for all emergency medical services delivered to Medicaid beneficiaries. The Senate Health and Welfare Amendment would change that from the Medicare basic life support rate for all EMS services to the applicable Medicare rate, recognizing that it might not make sense to reimburse at the basic life support rate for more advanced services. So that's just an informational piece. There's not a cost to that, but looking to find out what it would cost to reimburse Medicaid at Medicare rates for all of this. Section 4 is a conforming change, reflecting the addition of that section 3 language as to an existing statute that talks about the processes for reimbursement for ambulance service providers.
Yeah.
It says for Medicaid, look at that section, we just look at that new section 3 language. Section 5 makes some changes to the existing EMS advisory committee. most of the changes in the first part are really just some kind of housekeeping cleanup changes. Does specify on page 6 of the as passed by House version that the committee would have assistance from the Agency of Human Services. And then it strikes out the language in their existing EMS Advisory Committee annual report requirement. They have been reporting on the same information for many years and asked to have that report eliminated or changed. And so you'll see on page 8, this now directs the EMS Advisory Committee to develop and maintain a 5-year statewide plan for the coordinated delivery of EMS services in Vermont. We would have the plan updated at least annually with some goals, time frame for achieving the goals, cost data and alternative funding sources for achieving the goals, and performance standards for evaluating the goals.
So, in the 310, there was reference to EMS services as well.
We're gonna get some more of that in a minute.
I
We're
just
gonna get
wanna make
some
sure
money. We're gonna
Cross-reference.
get to a money piece.
I just wanted to make sure that they were aligned.
Yes, and that's actually mostly what the government operations amendment is to say, make sure that all of these different groups that are looking at coordination of first responder services are talking with each other. So by December 15th of each year, the EMS Advisory Committee is supposed to deliver a report reviewing the progress toward achieving the goals in the 5-year plan and what the committee's goals are for the coming year.
And the advisory plan, advisory committee consists of, I gotta go back here, that's on page 5.
Yes.
Oh, who's on the advisory
I'm just
committee?
looking.
Yes, so it's not changing it, but it's a representative from each
I
EMS
see that.
district, someone from the ambulance association, someone from the rural emergency medical services program,
Professional
UVM,
firefighters.
professional firefighters, career fire chiefs, and state firefighters association.
Yeah.
Um,
So that isn't changed at all.
That's not changing.
All right.
at all. Section 6 gives the EMS Advisory Committee some additional work. There's 2 aspects of this. The first part has the EMS Advisory Committee collecting the data necessary to do an inventory and assessment of the EMS services currently available in the state, including looking at numbers of personnel, spending, source of funds for all the spending, and identify information on identified gaps in services and overlapping service areas. And then it also directs the EMS Advisory Committee to provide recommendations for the design of a statewide EMS system. So one of the changes from the Government Operations Committee would add that this aligns with the purposes expressed in that first section of the bill in 18 VSA in section 901, optimizes patient care and incorporates nationally recognized best practices. And then it has them coming up with recommendations relating to a long list of aspects of EMS district structure and authority, workforce training, resource allocation plan to make sure services are available in all parts of the state, process for annual budget review of the EMS providers, governance model that meets certain standards, cost estimates, facilitation and coordination of training, and then anything else they think is appropriate. Directs them to talk to stakeholders. And it allows on page 11, allows the advisory committee to hire a project manager and additional consultants with expertise in EMS service design, system design and financing to help them with their work, and has the health department helping them. And the money for that you'll see later, but it's not general fund. Top of page 12, there's 2 reports. The first report due in December of 2025 is the inventory and assessment of existing EMS services. And the second one is by December 15th, 2026.
We don't have that information now.
We do not have a complete inventory and assessment. That's the first round of work that the EMS Advisory Committee is directed to do.
And how does the assessment, I don't know, I mean, it's easy to inventory, assessment has to do with.
Just evaluation. It's not an assessment, but just so they're on page 9, they're supposed to be looking at the number of full and part-time personnel, what the spending is, where all the money comes from.
I mean, historically, the biggest problem has been the level of reimbursement, their financial stability in the workforce. So I can imagine this is gonna tell us something that we don't already know.
No, but it's then supposed to inform their work on coming up with a recommended design, with recommendations for a statewide system. Because I think there's a lot of discussion about fragmentation, and lack of coordinated system for delivering services, and concern about there being parts of the state that may not have sufficient access to emergency medical services when they're needed. So page 12 is where we start getting into money. This is the piece that finance looked at, but we'll be spending the money out of it. Pages.
All right, so we went to that fund already,
So
In
yeah,
the
so
earlier
this
bill.
change
and so the question I
aligns
have.
with,
Okay.
it's the same change made in S310. So both of them increase the total amount that goes into the fire safety special fund from 1.2 million to 1.5 million through assessments on property and casualty insurers. And both of them direct that additional 300,000 to the emergency medical services special fund. So they're the same, it's a consistent change. 310 doesn't specifically spend money from the fund
But
this
this
year,
does.
this does. So Nolan and Chris, I think, have been
So
tracking the money throughout the process.
Right, so the only thing is the modest increase, the general fund share of the global commitment.
Right.
Um,
Are all of these in the budget?
Yes,
I thought
they are gonna be,
everything,
it was accounted for.
everything here is accounted for.
Correct.
The consultant that they're hiring, and it's odd that Department of Health has to provide the services, but they provide the money for that consultant.
No, that's what comes out of this increase. A portion of it comes from the increase in the money going into the EMS special fund. So on page 14, you can see the EMS Advisory Committee Appropriation Section 9. And that says, notwithstanding anything about how it says things ordinarily work in those funds. Other funds allocated to the EMS special fund, the sum of 150,000 is appropriated to the health department in FY25 to support the EMS advisory committee's work. And then to the extent there are unobligated funds in the special fund in FY25, up to an additional 220,000 is appropriated and made available to the health department for that.
So what they're doing basically is $300,000 for training, but for the first year, they're taking 150 of that, putting it towards this consultant for one time, and then going forward, just 300 towards training.
450 total.
450, sorry, because there's 150 there. And they did it that way because in the initial gov ops bill in the House, they had general fund doing a separate thing, and it was decided, no, just use the EMS fund, take a little bit out of here for this one time. And then going forward, it would all go.
But the only real general fund in this is the 31,000.
Correct.
So other questions, do you have a question? Oh, okay. So, and that's accommodated. Senator Sears, any questions on your end? Otherwise, we can.
No, I think the only thing I'll mention, and I don't know if, I don't think the bill affects it at all, but in Bennington, our local Turning Point Club, in order to avoid any problems with HIPAA, have become members of the EMT group and ride with them when there is an overdose. And I don't think that affects any monies or anything or any by the bill, but just to mention that it's something, and they've had a tremendous success rate of getting people who overdosed into treatment because of the joint venture. So I'm assuming nothing in this bill would change that.
Jen, is shaking her head.
No, I don't-
She
I don't believe so.
doesn't see any impact on this. It
No.
seems
I
like,
mean, it may be included in the inventory and assessment that they're doing of EMS services to the extent it provides greater service to the area than what we had in the absence of it, but that's.
Or then the
That's
training,
informational.
they include stuff from opioid treatments and
well,
training.
it's kind of, we've got a lot of legacy. I know Hardwick is primarily volunteer. Linden State College started one, you've got one at Calix. And of course, they're all struggling financially, and then the other part is workforce, and I'm sure liability is probably gonna be a big concern. So the big question now is, the money we've already accommodated, so could I have a motion to move the bill?
Yeah.
I'll second.
All right. Thank you. And Ben is here to, take us through 876. So we'll call the roll and then we'll move to our next bill.
Yes.
Yes.
Senator Sears,
Yes,
Senator Westman, yes.
Yes. Okay. So we're 502. All right. And the reporter, I think probably could be Senator Lyons. I can do it. So now we're gonna move on to, H876 and, we have Senator Sears remotely and Ben is here from Ledge Council. And we had, actually had some discussion around this bill,
Okay.
didn't we? Did we discuss
Yes.
it, Senator Sears?
yes, it's
So,
changing.
What we were concerned about was the section that was in there, that basically instructed the Secretary of Administration to find 7 management positions reassigned, and we ran into difficulty because DLC didn't have the money to pay them. They only had 7 positions in the pool, and so what we have is a fallback, which we had talked about and Ben has drafted, and Senator Sears has reviewed. And it basically is saying, this is a situation that we have, that the legislature feels needs to be addressed and sort of setting forth a plan of action to make some progress on it. So I'll let you take it from here, Ben, and then I'll have Senator Sears weigh in.
Sure.
Thank
Thank you, Madam Chair. Ben Obrowski from the Office of Legislative Counsel. As you said, the sort of history of this. In addition to that, there were some, to make it work the way that it was initially envisioned, there were some constitutional issues that need to be navigated. And this,
Oh, minor detail.
oh, yeah, exactly. Constitutional said.
Just separation of powers.
Oh, separation of powers. Oh, that.
Oh, that,
Oh,
yeah.
that.
Yeah.
Very much more.
So this absolves that issue, and subsection A, you'll see, so what it does is replace the old section A with what you see before you. And essentially establishes an intent and a plan that needs to come back. So the intent is that the General Assembly wants to afford relief to the probation or parole officers of DOC who are providing emergency coverage in addition to their own duties and responsibilities to supervise individuals in the custody of the department who are located or admitted at hospitals. And then subsection B establishes the plan that on or before January 15th of next year, DOC in consultation with AOA shall present a plan to the appropriation committees, the Senate Committee on Judiciary and House Corrections and Institutions to address the staffing shortages of the department related to hospital coverage, to specifically address general staffing recommendations to relieve PMP officers from providing that coverage, the number of staff required to provide adequate relief, and the costs associated with doing so.
You made it look so elegant. Senator Sears, anything you want to add?
Well, I mean, obviously I preferred the other version, but I think this is a good backup plan because I always thought that if we were going to fund it, it would be in the Budget Adjustment Act next year. So it
So
gives,
this would allow it, okay.
it would allow that, I hope. And it is a crisis and a problem that needs to be resolved. But overall, I will support this. I think it's a good compromise. And I will say there are costs associated with the current system because corrections has to pay the people that are providing the service on a standby basis. They have to pay them to be standby. And then if they go into the hospital, they have to pay them to be in the hospital. And usually that's overtime. So there are current costs associated with using the probation and parole officers.
I'll move the bill as amended.
Okay, well, you have a motion to move the bill favorably as amended.
I'll second it.
Okay, Senator Sears is seconded. Unless there are further questions, Ben?
Yes.
Senator Lyons.
Yes.
Yeah,
Senator Kirchler. Senator Sears.
Yes,
Yes, Senator Kitchen.
Okay, so move this bill out of favor. Now,
Sears would report it, or
yes, Senator Sears will report the bill.
thank you.
I don't know whether we have 5 minutes and it's on 6:45 and that's restorative justice, Tanya, is, that she's a reporter of the bill. We can text her to come. I'm just wondering if 5 minutes will do it.
Well, I did get a message from Representative Lalonde of concern about adding a section to the bill that would probably, since we've reached a mutual agreement on what's in that bill. So I know you're gonna, I think there's some positions that have been struck, that are being struck, which we understand was not in the budget. So that obviously is okay. But adding sections to the bill would be problematic.
All right, so what we have, if you want to just outline what Ben has provided to us, recognizing the fact that the positions haven't been created and the funding is not there and we're closed up the budget. We are having to do a little surgery to the bill. So if you want
Sure.
to review the amendment for us.
Right, so, would you like me to give a very brief overview of the bill as a whole prior, or?
Well, I don't know. Senator Mahowski was wanted to come in and present it to us. And I had her text. I mean, she said just text her and she would come over. She's over the Pink Lady. But we're down to 3 minutes before we're supposed to go back on the floor. So
this strikes out the sections.
Yeah, so what this amendment does, so for the record, Ben Obrowski from Office of Legislative Counsel, H 645 contains 2 positions. One to add to the Attorney General's office. So this would actually, let me start in order. Section 5 of the bill currently adds a Director of Policy position within the Department of State's Attorneys and Sheriffs to help coordinate policy development that's required in this bill for state's attorneys to adopt a policy related to the pre-charge diversion approach in that county. So what this does is strike that position because it currently reads, to the extent funds are available, this position would be established. Funds are not available, therefore it's being struck from the bill.
was this in the House passed version?
It wasn't a House passed version, but just qualified with that to the extent funds are available language. So it kind of accounts for it, but it's squishy, I guess you
So
could.
this is
say.
recognizing the being honest about the fiscal bill. Welcome, Senator. We're just starting. And what we're doing is not anything to do with the contents of the bill, except recognizing the funding is not there for the desired position, and that's what we're considering. But I know that the policy and so forth is really critical to move forward. So if you want to end our 3 minutes, give us a crash course on what this bill does and why it's important to the committee and to you.
Absolutely. So this bill, as you probably know, our restorative justice system is kind of patchworked across the state. And what this bill looks to do in one area of restorative justice is create more unity, create more geographic justice, and create more stabilized funding. And it does that in the pre-charge arena. So these are people who there's probable cause that they have committed a crime, but are diverted out of the court system before
Now,
charges
these are
filed.
youth,
It applies to youth and adults.
because I know juvenile was struck in a different term.
Well, so it's interesting. So the section is called, like, that's applicable is just juvenile pre-charge diversion, but child and youth are actually used in the substantive portion of the statutes because those are defined terms in Title 33.
So it does apply to both, and it is currently, many state attorneys are already using both. What it does require is that if a state's attorney is going to utilize pre-charge, they have a policy that they get to develop that is posted publicly so people know what that policy is. We heard from, I believe, all 14 states attorneys that they either have a policy or have one in process that should be posted. And then so that's that sort of standardization and unification of the system. And then it pulls the funding comes through the Attorney General's office. And so again, there are many issues in our restorative justice system. This is a step forward in creating a more just, unified, and transparent, better funded system. So that is I'm sure I missed stuff because we have 3 minutes.
Who could argue with that? right? Want to say that again? More. No, it's, sometimes I've equated what we do with Minoan architecture. And it's a bit here and a bit here, and we respond to a particular, and before we get done, it's a little disjointed, and sometimes it doesn't really connect very well. So, that image comes to mind as you're describing sort of what we've done over a period of time and trying to get it so it's, more rationalized and, more understand and consistent. Senators-
Derek Dubnik from DOC has described the system as an old Vermont farmhouse that has been renovated and patched up over time. So this is a renovate.
Well, I like a big labyrinthine, it's sort of what I think. Senator Sears, do you have anything you want to add?
No, we thought putting in if the money's available was good enough, but the committee wants to take those 2 positions out. We're fine. I don't think the Judiciary Committee would oppose that since we already discussed that the money might not be available.
Okay, you know, we're just trying to be honest with people. I think sometimes we want language that in the end creates a false expectation. And so, thank you for your comments. Knowing that we're about to go back on the floor, do I have a motion to move the bill favorably as amended?
I'll second it.
Okay. Thank you.
Did you get that, clerk?
Our clerk,
Thank you, Senator Sears.
our clerk is working very hard.
Oh, I know.
It's hard
And
being a clerk.
It's nice that he gets paid the extra money to be clerk.
All right. You have more bills?
I don't,
No, I
Want to make sure we vote for it.
I do want to make sure you vote for it.
Thank you, Senator Lyons.
Yes.
Senator Pritchett.
Yes.
Senator Sears.
Yes.
Senator Westman, yes. Senator Kitchell.
Yes. And the reporter would be Senator Sears. He
Fine.
says- All right,
Thank you so much.
Yeah.
I'll see you up there.
And just so you know, technically there was a second instance of them to remove the equivalent position from the AG's office, but
Yes.
it does the same. So
Yeah.
thank
And
you.
you don't have to put wording in there, it says that the other sections are renumbered. Well,
No, just about deleting them. Rather
that
than-
happens automatically.
Yeah.
okay. So, Senator Sears, do you want to report this one too? And how
Which
do I-
one's this?
This is, 645.
That's the bill we just discussed.
Yeah.
Yeah.
Yes, I'm happy to do that.
Already on the sheet.
All right,
Too late.
our clerk already has put your name down, so I guess you have to do it. It's just, okay.
I'm
And
worried about the power of the clerk.
Yeah.
so how do you work
Likewise.
this in terms of how do you communicate? Does the Secretary of the Senate send you something, or do I sign off for you? Or how we
You
work?
sign off for it.
I'll sign off for you, okay.
Yeah.
All right, so I'll let them know then.
Well, the other way is for Ben to send me a copy and then I send it to the Secretary of the Senate as approved.
All right, why don't you do that?
Yeah, and I sent you a copy, Senator Sears, so you should have that in your inbox.
So for both of these,
If I can find it.
I will resend this one. This was sent previously, but I'll make sure you've got it. So
Yeah.
it's a copy of
so
your-
you have two, you have the PNP one on the positions and the plan, that's 876. And then the other is striking the positions in 645, so
Okay.
you'll get both of them and then you'll go back, get it back to
Yes.
the.
Yeah, Ben can send me both of those. I send it to John Bloomer and then he approves it.
Because we'll probably move these bills out as quickly and.
Yes.
So there's no report except we did vote on it, so is there?
She's gonna come back down or maybe upstairs.
I'll do it upstairs.
Why don't you all sign out for me? It'd probably be
Okay.
easier since they are the bill. It's just amendments that I have put out. Somebody has to give the secretary the bill.
All right. All right. You've got.
Jenny, a good point. I forgot that
I'm gonna adjourn the
these are the
committee and
bills,
we'll,
not the.
we'll go off live and because we're gonna go back up to the floor, so.